Hello, and welcome to another session of Close Calls with California Poison Control System. I'm Dr. Race Vora, Medical Director at the Fresno Madera Division of California Poison Control, joined by my co-host, Dr. Cyrus Rangan, also with California Poison Control. And our featured expert today is Dr. Alana Bears with the Office of Environmental Health and Hazard Assessment, which is part of the California Environmental Protection Agency. Welcome, Dr. Bears. Thanks for being here.
Thank you.
We're going to speak today about pesticide safety. This is such a big topic, and I'm glad that we're covering it this year for Poison Prevention Week. Just to get us started, what is a pesticide? How is it defined? And what are some of the examples of how somebody might be exposed to this broad class of chemicals?
Sure. So a pesticide is a substance or a mixture of substances that's intended to prevent, destroy, repel, or mitigate a pest. And a pest can be an insect like a roach or a mosquito or rodents or fungus, mold, things like that. And so for pesticides, if you want to get rid of a weed, it's called an herbicide. If you want to get rid of insects, insecticide, fungus, fungicide, etc. And there's a few different ways that we can be exposed to pesticides if we use them in our home or in our yard or garden, or if we live or work near agricultural fields, we can be exposed. And they can get into our bodies by breathing them in, or if we ingest them, or if they get on our skin or in our eyes, then we can absorb them that way.
Now, Dr. Bears, at Poison Control, we interact with families and with clinicians on a regular basis. What should we be telling them about the most sensitive or susceptible populations to pesticide exposure?
Sure. So there are some groups of people that are more sensitive to pesticides. This includes children, pregnant people, older people, as well as people with certain health conditions. So it's really important to try and protect those groups from being exposed to pesticides as best as possible.
Thank you. I'm glad you mentioned health conditions. I think people are always curious whether pesticides themselves can affect their health. Short-term, long-term. How would you answer a question like that?
Sure. So pesticides are made to get rid of pests. So if they're harmful to pests, there's the potential that they could be harmful to us. So if we're exposed to a pesticide and we experience symptoms right away, this is called pesticide poisoning. We can see certain pesticides causing particular symptoms, but in general, there's a few common ones that we see. People can experience coughing, shortness of breath, difficulty breathing, sometimes headaches, dizziness, confusion, nausea, vomiting, diarrhea, things like that. If it gets on our skin or in our eyes, it can cause some irritation. Also, the severity of symptoms can really vary between people after they're exposed to pesticides. But sometimes we might not experience the effects of being exposed to a pesticide for weeks, months, or even years after. This is called the chronic effects or the long-term effects of pesticide exposure. And they found that pesticides have been associated with breathing problems, neurologic problems, as well as different types of cancer. And if you're pregnant, being exposed to pesticides can affect both mom and baby. They've been associated with things like preterm delivery, certain birth defects, as well as certain neurologic outcomes.
Wow. So given that there are so many different clinical syndromes and scenarios that can result, and the fact that we've got so many different circumstances under which people may be exposed, what should we be telling our families and our clinicians about the most important tips to avoid pesticide exposures?
Sure. So one of the best things that we can do is try to prevent pests in the first place. But if pests do become a problem, trying to use the least toxic option first will be the safest thing to do to try and prevent exposure. There's lots of different resources out there, but the University of California Integrated Pest Management, or UCIPM, they have a lot of really great information on preventing pests as well as implementing those least toxic options. But if we decide that we're going to use a pesticide, it's really important to read the label. The label is going to include a lot of important safety information, like what's the intended use of the pesticide, how much to use, if we need to wear any protective equipment, like a particular mask or goggles. And then in general, if we're going to be around pesticides or using pesticides, we want to wear pants, long sleeve shirts, closed-toed shoes, gloves, just to protect ourselves. Some other general safety tips: always store pesticides out of reach of children. You never want to move a pesticide into an unlabeled container or a food or drink container. And you never want to mix products together. Additionally, if you notice that pesticides are being applied in a public area like a park, you want to pay attention to any signs that might be posted saying when it is safe to go back into that area.
Great. So much great information about how to keep people safe with prevention tips. Moving into first aid and treatment, there seems to be so many different variations of the chemicals, the routes of exposure, meaning breathing it in, getting it on your skin, accidentally swallowing it, getting in your eyes. We hear about all of these at Poison Control. And this is just a reminder to our viewers to program this number into your phone. So if you do have that exposure and you need first aid advice or treatment advice, or you want to know whether to head to an emergency department to get extra care for your pesticide safety exposure, then the best place to call for all of those questions is our Poison Control Hotline, 1-800-222-1222. It's fast, it's free, it's confidential. Pharmacy and toxicology and emergency medicine experts are standing by to help guide all of those treatment decisions tailored to whatever else is going on in terms of what happened to you with pesticides or other chemicals. Just to switch gears, I know that we also get calls about whether pesticides are okay to use for creatures that may or may not actually be pests. And we thought we'd try to make this more of a fun activity by showing everyone pictures about creatures, and then we will basically go through and discuss whether this represents a pest or more of a venomous creature that's best left alone because it's not actually considered like an agricultural or an environmental pest. So let's play this round of pest or venomous critter, and we will show our first picture, which is the Oriental fruit fly. I'll let Dr. Bears take this one. Is this more of a pest or a venomous critter that's found in the state of California?
Sure. So this one is definitely a pest. And so it's important to know that the California Department of Food and Agriculture, or CDFA, monitors for this particular invasive species. So if there's any concern or questions about this one, you can go to their website and find out more information, especially if there are any noted quarantines in a county for particular fruits or vegetables. You can check there.
Good to know. All right, moving forward, we have a picture of a Western diamondback rattlesnake. Cyrus, tell us about whether this imposing creature is a pest or a venomous critter.
Sure. Well, obviously, rattlesnake's not something you want to have around you, and certainly a bite from a rattlesnake is considered a medical emergency. But these are considered venomous critters and not pests. In fact, they do a lot of good work in our environment because they eat rodents and keep rodent populations under control. So this is a venomous critter.
Great. And I think we have one more. This is it's kind of a mouthful, brown marmorated stink bug. So is this considered a pest or a venomous critter? Dr. Bears?
So this one is also a pest as well, and it is an invasive species that California Department of Food and Agriculture also monitors for. And interestingly, they've found that general pesticide applications are not effective at controlling the stink bug because they don't live on the plant that they feed on.
Very good to know. This is just fascinating, the biology and the life cycle of all of these different creatures. So I'm glad that we have experts within the state helping us to fight these creatures, protect our crops, but also keep people safe through OEHA and the EPA and all of the collaborations that we have with California Poison Control. Well, I think we are at the close of our session. This is so much great information. Once again, Please reach out to California Poison Control if we can help you with any questions, or if you happen to have the misfortune of being exposed to a pesticide and now you're just concerned about what to do next. We're standing by to help you with all of those questions, and we hope you have a safe and happy afternoon. I want to say thank you to my co-host, Dr. Rangan, and to our featured expert, Dr. Bears, for this informative and fun session. I really enjoyed it. Thank you so much.
Thank you.